Hello guys, welcome to SKK Classes NZ again. So today we are going to discuss about one of the important topic, that is Hyperemesis Gravidarum. This is type of disease which mostly occur especially in the pregnant ladies. Okay, the ladies who are pregnant, they experience or they have this problem. Okay, now what is Hyperemesis Gravidarum and what are their main signs, symptoms, and what type of treatment you have to provide to the patient or the person, and what type of you can say treatment that we can do in our own level, that we will discuss in this video. Okay, so whenever we are going to talk about the Hyperemesis Gravidarum, it mostly occurs especially in the ladies who are pregnant. Okay, or during her pregnancy, this type of problem always occur. So what is Hyperemesis Gravidarum? This is a type of medical term. Okay, and what happen in this, the ladies who are pregnant, they always experience lot of nausea and lot of vomiting. Okay, during their pregnancy period. Okay, means you always heard that the ladies who are pregnant, they always told you that I am feeling nausea, I am having vomitings, and it is very common in the pregnancy. Vomiting is common in the pregnancy unless or until it gonna swear. Okay, swear means if you are having one episode of vomiting in a day, so it's normal. Okay, if you are having two, it is normal. But if you are having vomiting in a day 5 times, 6 times, or 7 times, or 8 times in a day, so it means there is some problem. Okay, or you have to very much careful about this thing. Okay, because if you are vomiting a lot, so lot of chances are there that you gonna dehydrated. Okay, you will feel constantly dizziness, lightheaded, and you can also lose the weight. Okay, so fortunately there are some medicines or some type of treatment is available, so to prevent nausea and to prevent vomiting in this condition. Okay, so that it will not leads to dehydration, it will not leads to you can say fluid loss. Okay, let's discuss what are the various signs, symptoms of Hyperemesis Gravidarum. Okay, so first symptom, which is most common, that is severe nausea. Means you will having the feeling of vomiting, but you are not vomiting. Okay, and next symptom, you have to vomit, like you are vomiting in a day 5 or 6 times. So it means you are having Hyperemesis Gravidarum. And some women can lose weight due to this. Okay, and sometimes what happen, if you are feeling nausea and if you are feeling vomiting, you're not able to eat food. So whatever you are eating, that will be out from your stomach through the vomiting. Okay, and if you are vomiting a lot, so it means fluid loss is there. Okay, so means you will get dehydrated and you always feel dizzy, fatigue, weakness, lightheaded, and sometimes you're gonna faint. Okay, and you have a headache also. So these are the main symptoms of Hyperemesis Gravidarum. Okay, means if you are experience of vomiting more than 3 times or 4 times or 5 times, and other symptoms like you will have a dry skin. Okay, and your blood pressure will gonna low. Okay, why it's gonna low? Because you are going to be dehydrated and you have a fluid loss, you are continuously vomiting, and you always in a state of confusion. And in severe cases, okay, in severe cases, I'm repeating, jaundice will be there, and that will lead to liver damage. So this is the advanced stage, okay, of Hyperemesis Gravidarum. Now the question arises, what causes Hyperemesis Gravidarum? That what is the main reason behind this, that the lady who is pregnant always having a lot of vomiting? Now, what is the main reason of lot of vomiting in the period of pregnancy? As all of you know that there is a one hormone HCG. Okay, this hormone is known as human chorionic gonadotropin hormone. Okay, if when the level of this hormone is increased in your body, then sometimes what happen, the body will start responding to this hormone. Okay, and you will feel nausea or vomiting. In some ladies its level gonna too high, but in some ladies its level gonna medium. Okay, so if it's too much high, and so that ladies feel a lot of vomiting in this case and leads to hyperemesis gravidarum. And sometimes it also depends upon the ladies, females, okay, that how their body is going to tackle with this increased level of human chorionic gonadotropin hormone. Okay, so this all depends upon the hormone level. And there is another hormone, estrogen. If it also increases in it always increases in the during the pregnancy. If it's also high, so you will always feel a lot of vomiting. So what you have to do in this condition, if you are having a lot of vomitings in a day, like 5 or 6 times, okay, continuously, so you have to take the advice from some health professional, and you have to go to the doctor, and you have to take some medicines. Okay, means you have to consult the doctor or any physician in this condition. Now let's discuss about the treatment plan. So here I will say first one thing, that if you are having a severe vomiting, means lot of vomitings are there, sometimes you need hospitalization. Okay, but if you are having a less vomitings, so you can manage at your own level also. Like you can do some lifestyle changes. Okay, like what happened in the pregnancy, the size of the uterus gonna increase. Okay, and that will put pressure on the stomach, so stomach space will gonna decrease. So instead of taking like 3 meals in a day, suppose we always take like 3 meals in a day, breakfast, lunch and dinner. Okay, that's it. But in pregnancy you have to divide these 3 meals into again 3 meals. Okay, and I mean to say like if you're taking 3 meals, okay, you can divide it or decrease this 3 meals into 6 portions. Okay, I means you have to take in a small quantity. When it get digested, then you can take another meal. It doesn't mean that you, if you are taking like a full meal, okay, and you gonna full, so what happen in that situation? You will always do vomiting. Okay, because the stomach size gonna decreased, or due to the uterus size increased. Okay, so you have to divide your meals into some small portions so that it easily gonna digested. Okay, another thing that you can do here at your own level, like you can take some ginger tea. Okay, if you're feeling nausea, so ginger tea will gives you some relaxation, or some ginger chews. Okay, so that you will not feel nausea. And here I would one thing that I would like to suggest to you personally, that just try to avoid fatty things. Fatty means like oily things. Don't take oily food in the pregnancy too much. Only and only one reason. If you will take oily food, maybe you will having some you can say gastric problems. Okay, acid burn. Okay, you will having like burning sensations in your stomach, because fatty or oily food will not easily get digested sometimes in pregnancy. Okay, if you are not used to that, so try to avoid oily and fatty food, but whenever you are taking food, okay, take in small portion, and after taking food just do some walks. Okay, like a 15 minutes walk or 20 minutes walk, so that it will easily gonna digest it. But if you are like taking the food and you're gonna sit down or lie down, so it will not get digested properly. Okay, so to digest it after taking some meal, you have to walk for 15 to 20 minutes, not too much walk. Okay, and another thing, if you are having a lot of vomiting, so you should go to the doctor. Okay, and whatever medicine or whatever medication they will prescribe you, you have to take that thing. Like doctor always give you like anti-emetic medications. Okay, and if you are vomiting is so severe and you're gonna dehydrated, so it may be possible they will start IV fluid treatment. Okay, so that just to restore your fluid volume. Okay, and pyridoxine, that vitamin B6, and these are you have to take must. Okay, in the form of fruits, so that you will not feel nausea or vomiting. And another thing that ladies always told, or who are pregnant, the females who are pregnant, that they are having a problem to ride a car. Okay, means if they are sitting in the car and going somewhere, they will feel nausea or vomiting, and sometimes they are having some problem or with some smell. Okay, so the if you are having some triggers, okay, so you just try to avoid those activities. Okay, like if you are having a problem to go in the car or to drive the car, okay, so you just avoid that thing for some time, so that you will not feel a nausea or vomiting. Okay, so and in severe cases, if the patient get hospitalized in the ICU, okay, so in that situation, doctors always start intravenous fluid therapy. Okay, just to restore the fluid volume. And sometimes if patient is unable to take food, okay, they will start tube feeding through nasogastric tube. Okay, and sometimes they will give you TPN. TPN, total parenteral nutrition. Okay, just so that if you are not taking food by your mouth, so your body get enough nutrients and diet. Because in pregnancy, what happen, you're not taking food only for yourself, but you're also taking the food for your baby too. Okay, so just so that your baby can grow normally or develop normally, you have, doctors always try their best to provide proper nutrition to the patient. I'm talking about some medications, like doctors always provide you promethazine, metclopramide, ondansetron. Okay, so these types of drugs, they always prescribe you, or they will give you just to avoid nausea and vomiting. So these types of medical treatment that should be provided to the female who is having a hyperemesis gravidarum. But I will say only one thing. This you can say high level advanced care that should be provided to that female who is having a severe hyperemesis gravidarum. Okay, means if you are experiencing two vomitings in a day, so you just try your best to do some lifestyle changes. Okay, you can divide your meal in small portions. Okay, after taking meal, you just exercise or walk 15 to 20 minutes. Don't take spicy food, don't take oily food, don't take fatty food, which will not get easily digested. Okay, and try to take lot of fruits, lot of juices, lot of vegetables. Okay, but avoid spicy food. So these are the things that you can do at your own level, so that you will not feel nausea and vomiting. Okay, because if you are having one or two vomitings in a day, and you are feeling nausea, okay, or feeling dizziness, so these symptoms can disappear after 3 months, because I already cleared you that these symptoms are most common in first 3 months. Okay, but how you have to take care of yourself? You have to do some lifestyle changes. okay, so that this condition will not gonna sphere. Okay, so this is all about hyperemesis gravidum, and I think, yeah, and now it's very much clear to all of you. So thank you for watching SKK Classes NZ, and don't forget to subscribe my YouTube channel, that is SKK Classes NZ.